My partner and I were doing some work with community leaders in Latin America while they were looking to resource their communities with job opportunities, support programs for children and families. One of the areas that was really under-resourced was mental health, and namely, how do we help people to respond to all of the challenges that they face? HASA was an innovation. Nobody had ever done this before, thanks to teachers who contributed to the design of this program. People forwarded it to their friends, they listened to it over and over again. The response was incredible. We are only at the beginning of mental health innovation, despite many decades of extraordinary entrepreneurs who've paved the way. I think that the path is widening. We need more people to come along. I think there's so many ways to contribute to the mental health and well-being of your community.
Very warm welcome to you today. My name is Chris Underhill, and I'm here as your host for the Flourishing Minds Podcast. Today we have a very special guest, Daisy Rosales, who is the founder and chief executive of Brio, the organization that works in the field of community mental health. Welcome, Daisy. Lovely to have you with us.
Thanks for having me, Chris.
It's a real pleasure, real pleasure. Now, listen, I wanted to know how you started the organization, because it was some time ago now, but at least it probably feels like a long time ago to you. But in fact, it's still quite a young organization. So how did it all start? Give us a little bit of background.
Yeah, so back in 2015, my partner and I were doing some work with community leaders in Latin America.
Mm-hmm.
And one of the biggest challenges that they shared with us was around mental health of their communities.
Mm-hmm.
While they were looking to resource their communities with job opportunities, different sort of support programs for children and families, one of the areas that was really under-resourced was mental health, and namely, how do we help people to respond to all of the challenges that they face with more openness and agency and resilience? And so it kind of came upon us that there are so many community-based organizations and civil society organizations, really of all sizes, that bear witness to the everyday impact of the injustice and oppression and hardship that their communities face.
Mm.
And many of them are offering support because community members come to them. And so what if we could create a way to help them to respond to that need? So that was the initial inspiration.
Right. And we ought to give a shout out to Aaron, because it was him and you together who started it. Is that right?
That's right. And so at the time, I was working in the social enterprise space and also nonprofit, which I've done for the entirety of my career. And while Aaron was completing his PhD in clinical psychology to become a mental health professional here in California.
Right. And when you and I first got to know each other, you were at Yale, weren't you?
Yeah.
Is that right?
I had just started my MBA at Yale, and I went there because I was, I'd been working in nonprofits and social change for, all of my career, and I felt like I really wanted to understand how organizations and systems worked, so that they could serve people better.
So what a great combination, somebody with an MBA and somebody with a qualification, a clinical qualification in psychology. So it's like,
Yes,
it's like
in
a
theory, we
perfect.
should be able to run an organization.
Well, yes, an organization in mental health.
That's right.
Yes, that's right. Well, and the name Brio, where did that come from? Because I was intrigued by that when I first heard it.
Yes, that's right. Well, I grew up playing piano, and I hadn't fully appreciated the power of music until really later in life, as a place to express oneself, to kind of connect to a different way of knowing and being. And in traditional music and classical music, if you are told to play con brio, it means to play with spirit and vivacity. And so we thought that was a good way to describe what we ultimately hope that promoting mental health will do, which is to help people live with greater spirit and vivacity, even if life is continuing to be challenging.
That's great. It's such a bright name, isn't it? Which of course fits the music as well, and so that it really caught my eye. Why don't we jump into a couple of the projects that you were involved in originally? So you've described to us how you got started and what sort of impelled you in 2015-16 to get going. And so what were some of the early projects for you?
So one of the first projects we worked on was in partnership with an organization in Mexico City. They worked with human rights defenders and especially with families of disappeared people. And so for those who are not aware of this, there's been many, many years of violence and intimidation that has happened in villages, especially those that have been exposed to cartels. And one of the tactics is the disappearances of individuals. And so at the time, actually, I met a woman who was a world fellow at Yale, and she was a human rights advocate, really a senior leader in that movement. And I had the pleasure of getting to know her and her work, and told her that we were thinking about this model of partnering with community-based organizations to support mental health. And she said, well, the human rights movement where I work would really benefit from something like this, from the accompaniment and the partnership of this. Why don't you come to Mexico and meet some of my colleagues in my network? And
What a
so long
great
story short,
invitation. What a great
yeah, it
invitation.
was incredibly generous of her. And I think early on, we did have the opportunity to work with some of these organizations that were supporting families and human rights defenders. In other words, people who are going to the local municipalities all the way to kind of national government, advocating for human rights. And the reason why this is a human rights connection is because of the complicated relationship with the state that some of this how some of this unfolded. And so seeking justice, seeking for support in looking for missing family members for years and years in some cases. And so that was the connection. And so we were able to work with this extraordinary organization in Mexico City that was offering wellbeing support and training for the leaders of these regional collectives that were working to advocate for justice, to seek and find missing family members. And so they were kind of gathering all of these individuals who were leaders of these collectives and offering them, first and foremost, some care on the sort of physical and spiritual, medical, mental health levels, but also trying to give them skills that they could use when they went back to their regions and their homes, so that they can continue to advocate for justice if that was what they chose to do.
And I guess, I know there was more than one early project in that period, but I guess it was quite a steep learning curve from the point of view of, well, two levels really. One is a learning curve about what the community wants, how to meet those needs, and so on. And then the other level would be putting an organization together that can actually do more than simply do one project. Do you want to comment a bit about that? You can dive in either way.
Yes. So one of the key principles that was really important to us, from the beginning, was that we will work only in partnership and only in partnership with organizations that feel that mental health is really critical to the work that they are doing. They're witnessing the painful realities that folks are facing, or people are coming to them with mental health related concerns. and they feel that this would be integral to them achieving their purpose, their sense of mission. And so the learning curve was certainly around, I think, the content of, what kind of mental health support would be meaningful for the lived experiences of these communities that our partners are serving. And then on the other hand, how do we build an organization that is centered on that, and can follow through and demonstrate impact and contribution in this area? So those were two really big questions we were asking.
And was it at about that time, roughly speaking, that you registered the organization and began to have a board and all of that, or did that come a bit later?
Yes. So because I was in graduate school and Aaron was continuing his long years of PhD attainment and training, we leveraged some of the resources that were available to us at our schools, and were able to get some pro bono support and some shaping in terms of building out the bones of an organization. You were a big part of that as well, Chris, as a mentor. And this was really, really important because I think a lot of times people think about the work. So many of us sort of doers, social entrepreneurs, come to this with a sense of the need that we want to personally meet. And then we kind of start to bring people together to help meet that need. But the organizational building part is what enables us to sustain that work a little bit longer term than I would say maybe a volunteerism kind of approach. And so we were doing those things at the same time, learning a lot about, what is critical for organizations to have from the very beginning, not just so that we steward our resources well and treat people well, but also have a really clear sense of what we're here to do, and perhaps what we're here not to do.
Well, I always enjoy looking at the website because that's very clear. And maybe we'll give the website a bit later in the conversation. That'd be great. Why don't we jump a little bit in time now and have a look at some of the later programs that you're involved in? I know that you're involved, for example, in Rajasthan.
That's right. So when Brio was started, we were so focused on really community-centered, grassroots-oriented organizations, because we felt like that was where the rubber meets the road. You work with a grassroots organization, they're serving people, and they're going to do what they can pretty much immediately. And so we were learning pretty quickly through that process of co-creating these initiatives in Latin America. And then in 2020, COVID hit, and things shut down. And even though some of us may not remember it so well now, that was a really scary time for a lot of people. We were losing people in the thousands really rapidly. And there was a growing interest in the mental health impact of all of this. And so that's when we had also just completed a program with Acumen, which was a really big part of launching us kind of globally. And one of the Acumen fellows reached out to me, and he was based in India. And he said, hey, I've seen your work. I know that you partner with organizations to create mental health and well-being initiatives. We're wondering if you'd like to partner with us now that COVID is locking things down and people are really struggling. And of course, at the time, it was a new region for us, despite growing up around many from the Indian diaspora. Myself, I'd never been there. Aaron had never been there. And so, I told him that I was like, we'd love to help you. We've actually never been to India. And a critical part of our work up to this point is being there in the flesh, breathing the same air and walking the same streets as our partners. That's really important to us. And with COVID just starting, to shut down travel, we're not going to be able to come. Is that okay? And he said, absolutely, don't worry about it. Let's do this online. So in 2020, we started partnering with them, and their name is kshamtalaya. And it started with this vision to provide a super low tech and scalable well-being support program for educators. kshamtalaya works in the education system, the government school system in Rajasthan and some other states as well. And they noticed that the teachers, because they're government employees, and at the time there just needed to be a workforce to kind of manage the COVID situation, that many of the teachers were being pivoted over to COVID response. This is very scary, I think, for many of them, especially before we understood how the virus worked. All we knew was that it was killing people, and there was a lot of communication challenges around it as well. And so they thought, well, what can we offer these educators in this critical moment for them? What if we offered a program that was delivered via audio, so very, very low tech, that could be transferred via WhatsApp or even radio? That was the original idea. And that would kind of walk them through these stories and simple practices that could really help them get through this time. And so that was the beginning of our partnership with them. We created that program. It's called Hausla, which means resilience or courage. And that's a 21-day audio-based program designed for educators based on their experiences, especially in Rajasthan.
And I know that you now are able, because we're now past the pandemic, and you're now able to visit occasionally and work with them on the ground occasionally. So how has the program, Hausla itself, how has that developed further? In other words, you obviously had a particular start during the pandemic, and clearly it was a very positive response to a difficult situation. But how's it developed as a model?
So I think there's a lot of lessons from this. Hausla was an innovation. Nobody had ever done this before, and we weren't really sure how it was going to go. But because of kshamtalaya's knowledge of the educators' lived experiences, because of the work they'd been doing, and also thanks to teachers who contributed to the design of this program, which again is really central to our model, Hausla was super popular. People forwarded it to their friends. They listened to it over and over again. The response was incredible. And so after the peak of sort of the intensive COVID period, we kind of reviewed Hausla and said, I think we could actually turn this into something that could go beyond sort of the very serious constraints we were facing in the early pandemic. So we added launch sessions where teachers were invited to come in person to build a vision around personal well-being and also well-being in the classroom. And so, of course, the theory there is educators who experience well-being are able to show up to the kids in the ways that they would like to, and support a nurturing classroom environment. So there's a vision building session. We brought in facilitators for live check-ins. And so originally the program was just audio content, but now we had check-ins for the teachers, spaces for them to come and talk about what they were learning, talk about their experiences with each other. And then there was like kind of a closing graduation ceremony at the end of the program that the teachers could participate in and just celebrate the launch of their personal well-being journey and recognizing how important this was. And so once we started kind of putting those scaffolds around it, we also wanted to understand, well, what are some of the well-being impacts? Can we measure this? And so we've used a number of the validated scales, such as the WHO-5 Wellbeing Index, the Resilience Index, mindfulness inventories, et cetera, to see, okay, quantitatively, can we capture some of the impact that people are talking about? And we did find a moderate improvement among those who participated in the program. And that's really exciting because this was, a low intensity kind of program. It wasn't very expensive to run. And, a lot of it was delivered via audio and very low tech, which means that more and more people can use it.
So I get the impression that, correct me if I'm wrong, but I get the impression that the way you work has evolved over time. And so when you go back to those original visits to Latin and South America, Mexico, for example, and the way you described that work there, and wanting to be, as it were, in the same street, in the sense, in the same dust as the community in which you were visiting. And then coming forwards to today, there's a kind of sense in which the training element of this has really developed and grown, it seems to me, and the partnership element has got even more important than it was originally. So, for example, in Rajasthan, I know that you're working very closely with the government because the teachers come from the government, and meaning the state government, and of course the NGO as well, the partner NGO as well. So, would that be an accurate way of describing the development?
Yes. So I think, in our DNA, originally it was thinking about local communities and local organizations and what they were doing. Again, where the rubber meets the road, where it really happens, the actions. It was really our partners who inspired us to think about systems and scaling. And I think the reason I put it that way is because we have this ambition to make quality mental health support and programming available to as many people as possible. And we also recognize that the mechanisms for doing so, the capacity building, the collaboration, that's not something we will ever do on our own. And so when our partners began really connecting with the government, actually, they trained them on Hosla. They brought the Rajasthan State Council for Education, Research, and Training. It's a mouthful, but it's the RSCERT. They brought them through Hosla. And these officials loved Hausa. Actually, that was the entry point for kshamtalaya to do more work around well-being, is that the government officials actually experienced the quality of this program, which I think is really critical to cultivating some of that connection and even intrinsic motivation for civil society and government to partner together to work on mental health and well-being. So that was a really critical part of it. And you mentioned training as well. And so as we've evolved, as these initiatives have grown, we have had to figure out, what are the best ways to help people to not just build a cognitive understanding of these skills and the importance of mental health and how it fits into whatever it is that is important to them, but also to experience some of these shifts for themselves so that they can be advocates for it. And so that's a really big part of the training approach is experiential.
Thank you for that. That's very helpful to get that kind of sense of growth, but and of course geographical growth as well, but also depth. And so this sort of naturally brings me to the whole question of what it is that you, Aaron, and the board want to do about scale up. I know that you've obviously grown since those early days, that's clear. And you've obviously got, and I know because of the work that you and I do together, I know that you have obviously developed the organization substantially from the early days. So what are your aspirations now in terms of scale up, in terms of growth of the organization? Is it about depth? Is it about geography? What's it about?
Well, it starts with designing programs that really respond to the not just the pain and the hardships that communities face, but also their visions of flourishing. What does it mean to live a good life in this context? Because ultimately, we believe that mental health expands the range of circumstances in which we're free to move towards what's important to us. Life is hard. Work with social change organizations, and nobody disagrees with that. And it's still possible for us to make choices. And so I think at the end of the day, we want to understand communities' experiences, the experiences of who might be a participant, whether it's a teacher, a child, an adolescent, a mother, a refugee, a human rights defender, to really thoroughly understand their experience from the beginning. That's the depth. And then once we create a program and we, root it in evidence-based, which I'm happy to talk about as well, and we run the pilot, now we're looking for an opportunity to make this accessible to more people. And in some cases, that is the right next step is to work with the government and to see what integrating that into the public sector can look like. Now, I think that people rightly talk about depth and scale as concepts that are in tension with each other. And I think that's just, that's true from a mathematical standpoint. I mean, I can bear witness to maybe 100 people's lived experiences and actually talk to them. I can't talk to 100,000 people or 1,000,000 people. And so how do we think very carefully about what happens to these initiatives that, again, community members have poured a lot of effort into helping us design, so that they can go to all the people that it would resonate with. And so that's how we kind of think about scale, is there's a lot of upfront, really generosity from participants and community members and our partners to create something that speaks to lived experience and is really effective. And so that initial point is where the depth is. And then we work to codify that into systems so that more and more people can access them. And I'm going to name the fact that, when that happens, there are trade-offs and there are also just the energy shift, right? I think we can, use institutions are really good at some things, such as codifying practices, adding, accountabilities, monitoring, making requirements, doing training, implementing things kind of like a machine. And so you kind of think about, well, what would it look like to translate this program and this experience into what the institution is capable of doing? And that also requires a lot of time and careful thought.
So it sounds to me as if you're using this careful thought in several ways, but one of the ways in which you're using it is to tailor your approach to some extent to the circumstances and the context of the community you find. And there are other elements which kind of remain with you and are probably useful to you in many different projects. Would that be true?
Yes. And, I think part of it is the continued coalition building. And these are the sort of the soft skills that are really hard-edged skills that I've seen in many of our partners who are very gifted and persistent as they work in systems. Not only to talk about the tactical components of, okay, operationally, how do we train 150,000 teachers to deliver this program? Like, how is that done? But also the relationship building aspect of it, understanding how people are motivated and tapping into intrinsic motivation, not just extrinsic, right? Not just sort of the rewards and the punishments that the system can offer, but why is this important to this person who is a decision maker here? And so I think those are some of the key skills that we're continuing to learn alongside our partners in doing this work. And that's important at the community level, at the smallest unit, all the way to scaling in systems that are reaching millions of people.
It's so interesting the way that systems change. Always goes back to individuals almost, or very small amounts of communities. So you get that kind of circularity, don't you? Which is very interesting from the point of view of the work that you and Aaron are doing. Absolutely. We're pretty much getting to the end of our session, I'm afraid to say. The time has whizzed by. I just wanted to say, I'll ask you one more question in relation to the program, and that's as follows. Would we call what you do the Brio model, or would we call it an approach? How do you, or is there another word which best fits it?
Yeah, I think, we could call it Brio TM. Um, but, I think ultimately what we're trying to do is build a bridge between what so many extraordinary community-centered and civil society organizations are doing. They've got one foot deeply rooted in that experience, and they've got another foot in the systems, in the ways that could really change or impact many people beyond the communities that they're directly working in. And so we're layering mental health into that. And so I would say uh, a big part of our model is this collaborative approach. Another is integrating the evidence. And the third one is looking at how do we scale for mental health promotion.
Hmm. Well, that's very clear. Let's give the website of the organization. Do you want to just say it out?
Sure, it is startbrio.org. That's start as in begin, STARTBRIO.org.
Great. And if people wanted to get in touch, is there
You
an
can
email?
email me.
Yeah,
There's a contact form on our website, which I'll get, or you can email me, and it's daisy@startbrio.org.
great. Thank you. And finally, would you encourage others to go the journey that you've been, to work now that you are fully working in the field of mental health? You can look back over the few years, well, some years now, since 2015, and you can see the growth and the way that the organization has become substantive in its approach. Would you encourage others to go that route?
I think that we are only at the beginning of mental health innovation, despite like many decades of extraordinary entrepreneurs who've paved the way up until this point. I think that the path is widening, and we need more people to come along. And that doesn't mean you have to start an organization or be, a capital S social entrepreneur. I think there's so many ways to contribute to the mental health and well-being of your community. Um, and, I think it is becoming increasingly important, as it always has been. Some of the cosmic shifts we're looking at are climate change and how that's impacting communities disproportionately and causing a lot of pain and suffering and change. Another is we've seen the rise of authoritarianism across the world. And what does governance look like, and how is that impacting people's lives? And are people losing the kind of support from the system that they really need, especially in marginalized communities? And the last one is we're on the brink of another technological revolution. And we know that, as with always with technology, there are some benefits to get really excited about, and there are some perils that, it remains to be seen if we avoid those or not. And so I think in terms of need for this work, I'd welcome anyone who wants to pursue it to come alongside us and be a part of it.
That's great. All welcome. That's a great way to finish this particular session. Daisy, I just want to thank you very much indeed for being with us today and giving us a wonderful story about Brio and your wisdom as well. Thank you.
Thank you so much.